right, today we're going to be going over the humerus. So this is the humerus, it's the upper arm bone. This is the anterior side. Medial is over here, lateral is over here. Flip it over. This is the posterior side of the humerus. Medial is here. Medial is here, lateral is here. So we'll go through some of the bony landmarks now. The first landmark you guys need to know is the head of the humerus, which is this part right up here. So this is like the ball end. It's going to articulate with the glenoid cavity in the scapula. So it's going to make your ball and socket joint for the shoulder. As we move down, the next landmark you'll need to know, this is the medial end. As we move down, go over to the lateral side. This is this rough area over here. This is the deltoid tuberosity. And this is going to be where your deltoid muscle attaches, so it's a roughened area for muscle attachment. We're going to move down to the bottom of the humerus now. This is the posterior side of the humerus now. So this is going to be the olecranon fossa. And when we talk about the ulna, you'll learn about the olecranon process, and that articulates here. We also have our medial, which is the pointier one here. This is the medial side, medial epicondyle. And then on the lateral side, we have the lateral epicondyle. Just inferior to our olecranon fossa is going to be the trochlea. And this right here is where our ulna is going to articulate with the humerus. And this trochlea is usually covered with articular cartilage. If we flip the humerus over and look at the anterior side, then you're going to see this little depression here. And this is the coronoid fossa. Coronoid fossa. All right? And to be able to tell this from left to right, you just need to be able to tell which is the anterior and which is the posterior side. So the posterior side is the bigger notch, right? The olecranon fossa. And the anterior side is the smaller one, the coronoid fossa. And then if we look up here, the direction that the head points in is always medial. So then you can think if this is medial, here, this is going towards the body, this is anterior, then this would have to be our, which side? Or right humerus. All right. Next, we're going to learn about the ulna. All right, so this is the ulna, and this is the area right here that would be articulating with the humerus, which is what we just talked about. So the first landmark on the ulna we're going to talk about is the olecranon process. And so the olecranon process is this whole area back here. So this would be like the back of your elbow. So this whole area back here is the olecranon process. And remember, we have the olecranon fossa on our humerus. So this part of the ulna is going to articulate and go right into that olecranon fossa. Right, so the olecranon process. This right here, this sort of U or C-shaped notch is called the trochlear notch or the semilunar notch. And this is going to articulate with the trochlea of the humerus. Now, if we keep going inferiorly, this sort of little beak-like projection here at the bottom of that notch is going to be called the coronoid process. And as you can probably guess, the coronoid process is going to articulate with the coronoid fossa of the humerus. As we keep going down the ulna, we're going to see this part right here, which is the head of the ulna. And then we have this pointy process right here called the styloid process. And the ulna is going to be located on the pinky side of our arm. And so the styloid process is going to go right down here, and you can actually sort of feel that on your wrist. All right, the styloid process. After the ulna, we're going to be talking about the radius, which is the other forearm bone. These two bones are going to be held together by an interosseous membrane. So they kind of sit like so, and they're held together by an interosseous membrane. There are just a few things you guys need to know on the radius. The radius also has a head. The head is going to be on the opposite side, so it's going to be the more proximal part of the radius, and it's the very round part. So this is the head. And this head is going to be the part that actually articulates up with the humerus. Next, moving just down from the head, we have this lumpy area here, and this is going to be oriented towards the ulna, and this is the radial tuberosity. All right, the radial tuberosity, so it's the lumpy, bumpy part on the radius. And finally, as we go down to the most distal part of the radius, we have, again, the styloid process. So we have the other styloid process. So you have two, one in the radius and one in the ulna. And so the ulna, or the radius, is going to be found on the thumb side of our arm. And so it would sit like so. And so you'll be able to feel your other styloid process also. It's the other side of your wrist.